speaker, Dr. Sheela Vemu. Her ATE project talk focuses on a workforce initiative that equips a diverse new generation of water and wastewater technicians through industry-aligned training, experiential learning, and targeted student support. Welcome.
Thank you, everyone. If you see me struggling how to get to the next slide, just be patient. Our topic today is water biotechnology. That's the grant that we are in, and it's to improve the blue economy workforce. We are at Waubonsee Community College, which is in Sugar Grove, Illinois. So we are northern Illinois. So you know Illinois is a very long state. So we are northern Illinois, closer to Wisconsin than to Springfield, Illinois. And as you can see up here, that little person surfing, that's how me and Nancy Christensen feel at this present moment, surfing this grant and working our way through to the next parts. So water is far from what we think of as an environmental resource. It's actually an economic engine, because the water has this ability to take infrastructure and advanced manufacturing and stuff to energy, environmental innovation, and it is also what will generate the next activity in our Great Lakes region. I would say, we're very fortunate that when we were trying to write this grant and start to think about what is the best thing for our college, that there was this Great Lakes Renew project, which is a regional National Science Foundation grant for Illinois, Ohio, and Wisconsin. And the idea of this grant was to attract water-intensive manufacturers in the region. The goal was to make sure that the wastewater streams were converted into mineral resources and valuable energy, and also for recovery, circular economy. All this was happening in that area. So if you look at, this is where the Renew engine was located, and this is where our college is, where I'm pointing to right now. So we were lucky in some ways that we could use some of the resources that they had, and we decided to partner with them as a workforce anchor so that we could also learn and take some of their contributions and perhaps contribute back. So this is what we have done so far in our grant projects. We have used the industry to co-design the curriculum, because we knew a lot of textbooks, we knew some KSAs, but we really didn't know what happens in the technical world. What does a water technician do in the industry? So we adopted the BUILT model, which is the business, industry, and leadership model. It's an advisory committee, but it is co-led, so employers have a stake. They just don't give us some advice. When they give us some advice, we ask, what do we do next? So they have a contribution, and they are also accountable for that contribution. At this moment, we have 15 industry partners. We started off with 2 or 3, which we called as the foundational BUILT. And then over a period of time, every semester, we picked 1 or 2. And there are utilities, there are associations such as the Water and Environment Federation, the American Water Works, and then regulation companies, as well as microbiologists who retired from the water industry who wanted to be educators. So we put together from the associations a large KSA list for almost 300 of them. And then we decided that our industry folks, would do what we call as a voting practice, where they would vote and say, is this something that students need in an introductory classroom? Is this something they need in an intermediate? Or is it advanced? Or is it something that we can sort of mesh it together between a couple of others? Or these are things that they should know prior to coming in. So the industry is also involved in our curriculum refinement, which is great, because now we started off as 27 credits. We have brought it down to 21 so that it can actually be helpful for our students as well as it saves them money too. They were the ones who asked us to put together the guaranteed internship or the apprenticeship pathway, and these are paid placements that every student in the cohort would have. So which means the industry had to get we had to get a buy-in from them, because they would be paying for the student internships. So what you see is our first cohort of students, and a couple of industry folks who come to the classroom. So that's another one. The built model, we ask many of our industry members to come to the class at least every 3 to 4 weeks, either through Zoom or in person, so that they can not only talk to our students about the innovative, cool stuff that's happening, but also create this belonging and for our students to sort of retain their motivation in the program. They also talked about career changing, which is very important for students to think about and not just say, I want to be a water technician. Maybe what are the other things you can do by being a water technician? So the first cohort, we had 20 plus students. Many of them are career changers. They came from healthcare, manufacturing backgrounds. A few of them do have undergraduate degrees in different fields. Many of them are adult learners, as you can say, non-traditional. There's a couple of 18 and 19-year-olds. We can tell in the classroom when they're 18 and 19. It's a diverse cohort. We have folks from different demographics. And you can see in the picture, a couple of our students got the IWPC, which is a national conference for wastewater. They were the inflow scholars for STEM. So what do students learn in a water biotech at a technician level? These are all the categories that the built model helped us put together: microbiology and biological treatment. So there's some pathogen detection, biological nutrient removal, biofilm stuff, some water chemistry, analytical chemistry. That's why my co-PI, Nancy Christensen, she is a chemistry faculty member. So we talk about dosing, pH, turbidity, sampling protocols. We have just added a course on process operation because intelligent water, digital water is here and it's going to stay. So a lot of safety compliance, pump systems, SCADAs, how Bluetooth can be used for water technicians, all of that. And then we have a course on data literacy and environmental systems, which is typically digital record keeping, sustainability assessments, and learning how to monitor and sample and take some graphs or able to analyze through a graph that's already created by the industry. So the year one outcomes, this is what the industry helped us co-design. So we really don't want to take all of the credit for it. We've had 86% first year retention rate. We had 100% guaranteed paid internships, $15 an hour, 80 hours paid internship, and it's credit-based, so it helps our students fulfill their credits. And then we also had a survey talking about how the industry partners collaborated with us. Did they feel that we were listening to them, and did they feel that there was enough feedback for them to create a model? And we found that it was 95%, and we have 2 students who are Inflow National Scholars. Because of the model and our ability to connect with the National Science Foundation research engine, which is the Great Lakes Renew, we were able to get some national recognition for our program. Our students were actually featured in the Splash magazine, which is the ISAWWA, that's drinking water. So our students they had an opportunity to contribute to that. A few of our students were nationally recognized because WEFTech, which is the largest wastewater conference, happened to be in McCormick Plaza, which was in downtown Chicago. Of course, we couldn't say no, so they gave us some discount registration for the entire cohort of students. They were able to not just go there, but they got a tour. They were actually taken from areas, they were given some guidance, there was some networking. They got a chance to actually meet a lot of folks from different parts of the industry, ask some questions. So it was not just a tour, it was something which was very personalized. And that's because one of our industry partners happens to be in the operator region of the WEF in Alexandria, Washington. I talked about the STEM Path program. Recently, we had an opportunity to be in a Blue Economy fireside chat. One of our built members, which is Xylem and Current Innovation, they do digital water and they do intelligent water systems. They wanted us to talk about how the employer-driven water workforce, and they featured 3 of our students in a panel. And in June, 5 students are being selected to be part of a panel for sustainability at AWWA. So I'm bringing all this up to say that The built model that we were able to sort of modify and use in our systems got our students the national recognition that they totally deserve. Is this a replicable model? Probably yes, but it requires some thought into it. And these are the things that folks can use. What you see in the picture up there, we were at a panel just last week at WaterCon, which was in Peoria, Illinois, and that's drinking water. Our students were presenting their ideas on what they thought was the connecting dots between the coursework and the internship that they're doing right now. What did you learn in the course, and how does that connect to what you're doing in the lab? Folks, if they wanted to adapt, they could start with this co-leadership model, but not just ask for feedback, but make sure that there's consensus building within the advisory meetings. And there is some curriculum validation, and everybody in the build agrees on most of the things that you want to do. You can map it to regional certification pathways. We were lucky because of the current and the NSF engine. We have some certification pathways that we can map to other community colleges in our region. And also there are a couple of 4 years in Northern Illinois that have soil science. So there is a way for these students to not only finish this certification, get a technician degree, but also finish the AS and perhaps even move on to an undergraduate if they wanted to. I would say the key piece is to embed work-based learning from day one. I think the guaranteed internships got us moving really fast. We were so nervous that as soon as this cohort of students came into our classroom, the first thing that popped in our mind was, where are the internships? How are we going to get the paid internships happening? So I think embedding that in the curriculum gives you the drive to do it. And then connecting with the broader innovation ecosystem is really important, because the students feel that what they learn in the class is not exactly just sticking to the curriculum, but it also sort of adapts and connects with the broader ecosystem. So if they just didn't want to work in the utilities, they will also have an opportunity to work at other spaces and navigate their careers to wherever they need to go to. So this is the end of our presentation, but I'll be open to some few questions. I think we have like 5 or 6 minutes. The water sector needs science-trained technicians, that is for sure. And when I say science-trained, the industry really believes that if the students have a foundation in math, contextual math, if the students have a foundation in contextual chemistry, and they understand the microbiology and they understand some of the lab details, this is just a starting point for them to get careers that just will continue to be AI proof. Everybody needs water, so water careers are going to be available, and jobs in this sector are not just technician oriented, but they also can be non-technician oriented. So you're giving students an opportunity to just start somewhere and move forward. And with that, I wanted to thank Innovate Bio and all my dear friends in this group that I have learned so much with. Thank you.
Thank you, Sheela. And we will hold off the questions until after the second presentation. At this time, I would like to introduce our second project talk speakers, Dr. Nicole Bradley, the project PI, and the project co-PI and biotechnology instructor, Kevin Rodriguez. This ATE project focuses on the National ATE Initiative of Advancing Cell Therapy Biomanufacturing by developing industry-aligned, hands-on training that prepares 2-year college students for high-demand careers in producing life-saving therapeutics. Welcome, Nicole and Kevin.
Thank you. I appreciate that. Can everybody hear me okay? All right. So I built this presentation to have a little bit of background as to why we chose specifically this grant topic, as well as some updates in our grant as well. So our grant is an NSF ATE funded called ACTIVE for Advanced Cell Therapy Industry Aligned Vocational Training. We are partnered with our partners of Innovate Bio, as well as our NIBRT Global Partner. And we really wanted to bring into the fact of why Houston, why biomanufacturing, and why advanced cell therapy. And as many of us all know, biomanufacturing, right? We are here to create a multitude of things, right? Chemicals, products, medicines, vaccines. But the biggest thing is that it comes from a living cell, such as bacteria, yeast, or mammalian products. And it offers, really, really critical materials and stability for supply chains. We are a multitude of companies. We have students that come from all walks of life, from mathematics, biology, chemistry, even engineering, and we help merge all of those products together. And we really wanted this curriculum to be able to be sought after by multitudes of different students. We've got students who already have degrees in mathematics or engineering that are entering our current programs. And we really wanted this training that we're building through the grant to be able to be delivered to all types of students. So the next topic was, why Houston? Why do we want to really push this forward to Houston? And a couple of the biggest things is we're the fourth largest city in the United States. We also have one of the very most diverse populations of people, as well as diverse topics in education. Two, we are the largest chemical complex in the U.S. across the eastern side of Houston. And with our ship channels and our ports and our space center, we have a lot of opportunity to expand the biopharma, the biotechnology, and the biomanufacturing aspects. We have the #1 U.S. port with over $9 billion in economic value per year. We're the first largest medical center in the world with TMC. And we actually, our college just signed an MOU agreement this past Tuesday with the Texas Medical Center to hopefully be able to build a curriculum and a training site there at the medical center, which this grant's curriculum would be incorporated in that site. We also have 2 major international airports, which also help service the industry and be able to provide the training in a more national level, as well as be able to kind of just bring all of the infrastructure of biotech, biomanufacturing to the region. So moving with that, right, San Jac was already established as a major force in workforce training. We had healthcare, education, petrochem, aerospace, maritime, and now we've added biomanufacturing. And this really, really serves as the ability to work with multiple components, cross-training. We've already begun our development with curriculum between multiple entities, including HVAC, including petrochem. And so we want to really, really start bringing multiple components together that can all serve biotech, biomanufacturing as a whole. So as we started working on this grant, we were actually in the process of building labs that would then in future support the efforts of this grant. So we now have 2 fully active campuses for our program. We began our initial cohort of 20 students in fall of 24. And our brand new center is over 20,000 available training space with full operational upstream, downstream fill finish laboratories, as well as a fully functioning ISO 7 clean room that will be fully qualified to the FDA standards coming up here in this next quarter. And all of these is what we're going to be building that advanced cell therapy curriculum around and building it up to. But we need to have the infrastructure for our curriculum to be useful, right? So we have partnered with a number of industries to help us with this grant. And we've partnered with, we reached out to our advisory committee, which is chaired by Lane Linden from CTMC. And our committee is going to consist of members from multiple companies. And they've already started providing feedback as to the curriculum and the alignment that they want for this NSF grant. But we didn't just stick with cell therapy. We pulled in gene therapy as well. And so we've got CTMC, Lonza, Neurogene, PacGene, Immatics, and Cellipont are our prime players moving forward into our grant. And they're going to be providing a lot of information as far as the curriculum and the alignment and the topics that they want covered. Additionally, a couple of things that we wanted to ensure is our curriculum is aligned to degrees. And so the curriculum we're building it into modules. So if you kind of look toward the center of the screen, you'll see that like upskill, reskill area. And what we've done is our new curriculum with the Advanced Cell Therapy grant is being built into individualized modules. Each of those modules will be built into the direct curriculum of our AAS, as well as our level 2 certification and our advanced technical certification for students who already have an associate's or bachelor's or higher degree. So we're building our curriculum to where it's fully integrated into all of our academic courses and that they are pluck and chuck modules as well. So then that way we can have almost in essence have shorter certifications, short certificates that when you match them all together or puzzle piece them together, they give you credit for a course. So you'll get full course credit through our modules. And this will incorporate as well building new WECM courses as part of the grant. So what we've currently offered and launched are 3 separate certification levels. We have our occupational certification, about 9 months and 5 courses. The advanced cell therapy will attach to 1 module in the occupational certification. In the level 2 certification, you will get an additional, the idea is 2 modules, and then the final module would be obtained during the Associates of Applied Science. So it's the encouragement of students to continue moving forward and continue gaining the different certification levels and being able to build on to the modules that we're going to be building through the Advanced Cell Therapy grant. And what's really, really unique with this is that we really want the mastery model for our students. So the curriculum we're building is building students toward mastery rather than introduction. So students will have multiple levels of hands-on. It's 80% hands-on, 20% theory. And then it is also designed with one-on-one observation to where students have an individual assessment that is observed by a faculty member teaching the course to ensure that the student has actually mastered the technique and or mastered the skill. We're also building in retests, so if students do not pass with that 80% or higher, which was established by our industry committee, students have the opportunity to retake laboratory exams, retake equipment exams, because the idea here is to actually teach that process and actually get them to really understand that hands-on, that technical. I can't bake bread, but I'm going to keep trying. So it's all about working forward and keeping that process going. So a couple of the major key players here is our first one, of course, is bioindustrial manufacturing. That's one of the major key players. We pre-started, we have curriculum, and we're building it forward. Then second, we worked with petrochem and we're working on a process of cross-training between petrochemical. Third, we have that traditional biologics, right? So you've got your vaccines, your monoclonal antibodies, and you've got your traditional products that you're producing. Then we have our newest adventure, low Earth orbit manufacturing, and we're working with a couple of teams to work with biomanufacturing and bioreactors in space. And then the last one that we'll deal with is our brand new sector, which is going to be a individualized track through the curriculum, which would be advanced therapeutics manufacturing. So what does that mean? What are we truly looking at when it comes to advanced therapy? So where did our grant start? So we actually worked with, I worked off of Margaret Brains, Jim DeClos, and John Creasy's established cell therapy and gene therapy skill standards. They built a wonderful skill standard booklet pictured here at the bottom corner that really walks through the core skills, the technical skills you'll need for cell therapy and gene therapy curriculum. And what we decided and our industry partners have asked for is they want the next level. So they want to take all the students that have established and succeeded at these skill standards, and they want to go to the next level. They want to know what are the advanced skills, what needs to be attached. And that's where our grant was born and what we've been working on. So far, our industry partners have identified five key categories that they want the curriculum to cover. The first is ISO 7 clean room operations. And this is going to be the cleaning and maintenance and the environmental monitoring. So viable, non-viable particle counts, settle plates, and personnel monitoring. They also want gowning qualifications for ISO 7 clean room operations. So that's topic one that they've asked to expand on the current listed skill standards. And they're going to work with us into developing a brand new set of skill standards for advanced cell therapy. They wanted to include final product, vial, and bag inspection and filling. So looking at defect kits and lot inspections, and then discussing cryopreservation preparation and timing, and cell loss and viability of products over time. And then they had advanced cell therapy instrumentation, which includes a number of listed. I didn't want to list them all. So they talked about cellular processing instrumentation, Clinimax, Prodigies, Clinimax Pluses, Lovos, Cytiva equipment. And so they wanted students and trainees and technicians to be able to operate these instrumentation. They wanted isolator technology, so understanding the difference between clean rooms and isolators and how isolator technology can be utilized in the cell therapy world. And then finally, they wanted to expand on preparations for FDA audits and inspections. So they really, really, really wanted these students to understand how to operate during an inspection, why what we do in a biomanufacturing facility is so important. Why is our GDP important? Why is it critical that our signatures look exactly the same every day? Why is it critical that our calculations are triple checked by through different people? So they really wanted to understand. And then how do you communicate to the FDA? What are you allowed to say? What are you not allowed to say? And so that's kind of where we have kind of landed. We will be actually utilizing the cord built model as well with our grant. And we're getting that launched actually here in about a week. And we're going to be incorporating that and helping utilizing their program to help develop our skill standards. So that is my last slide. And I apologize if I talked fast. Kevin, do you have anything to add?
No. You covered everything. Really. Um,
Thank you, Nicole. Great presentation from both Sheela and Nicole today. At this time, we have time for questions or comments. Please feel free to either post a question in the chat or raise your hand, or you can just speak up. And for those of you who did not notice, Ying-Su did place a link to the publication that Nicole referenced in her presentation.
Oh, thank you. I appreciate that.
Hi there.
I'm sorry, Jeffrey.
Hi. My name's Jeffrey Tao, and I'm from Chabot Community College, and we're in the San Francisco Bay Area. And we're mainly focused on health sciences, but we have a general biology group. And we're interested in embarking on a similar journey, but we're starting from the very beginning. We have a lot of young faculty that are interested in developing, some sort of biotechnology training, but we're at step 0.1 basically in this journey. So I want to thank you for your presentations to help give us sort of a view in your process. What do you think are some of the first steps that I can take with my colleagues as we are trying to basically start this process? Because I think about a decade to 2 decades ago, there was a partnership with Genentech through another community college that sort of fizzled out with some economic downturn issues. So we're trying to reboot that sort of spirit after having sort of, closed that down for a while.
I can speak a little bit. My suggestion would definitely be I would definitely reach out to Jim DeClo. He is the one that pioneered and piloted that curriculum out of Vallejo with Genetech. He was kind of like one of the first founders of a biomanufacturing biotechnology curriculum. Second step is don't build a curriculum without an advisory committee. So do your dig, do your research, look at the companies in your area. I know you guys have like Biotech Bay, you have, if I'm not mistaken, like Maze Therapeutics. Sorry, I'm from originally from Northern California, so I'm trying to remember. You have, I think, Emory Pharma. So I would definitely reach out to like those companies, ask them to join your committee. You want to look for manufacturing managers. You want to look for technicians, like level 4 technicians from all walks, right? QC, PD, manufacturing floor, supply chain. And you want to say, like, what's the one thing lacking, right? If you could hire anybody, what would you want them to have? Because then they're really going to help you design your curriculum. And that's how we've been able to make our curriculum so customized while we use the process of, we use our WECM courses that are pre-built and, you follow your SLOs. You can add SLOs, you can just never take away from your state SLOs. And so we've added a number of SLOs that are based on what our industry partners have asked. They asked for ISO 7 gowning and we said, okay, right? They asked for micropipetting with a 3% error rate. We said, okay. So they're telling us at what level to test. And then the last thing my recommendation would be is I would suggest to work backwards. Write your tests first. So what do the industry partners want tested and to what level? Do they want a 5% error rate or 3? Do they want, what key equipment, key processes do they want to be tested on? And then from there, you build the labs. And then from the labs, you then build the theory. So you work backwards because you want to ensure that your labs teach the tests that you need to test and that your theory truly also teaches what you want to be testing on.
Thank you.
So, Jeffrey, a different take on what Nicole said, and very similar, is we started off thinking we wanted to do biotech, but we were so far out in the woods, in probably the prairie region, that the idea of doing biotech and working with the big pharma companies started us to be very excited, enthusiastic, which is very important. But we became very realistic. It's like, who are our partners who are 20-mile radius? And I think that is the biggest question you want to ask, because where would our students be employed? And is it just about knowledge gain, or is it about making sure that this is a workforce engine? And I think as academics, we struggled a lot with that. But then you will find partners, you will find folks, and that's how we found the NSF Great Lakes engine, who will help you to move forward and say, hey, this is a workforce engine. So we want our students employed. Where are they going to get employed? And what do they need? What do they need in order to get employed? And then we stopped thinking and then started acting. Because sometimes you can just get into this wormhole of thinking and doing, and then you don't know where your students are employed. So that's my take.
Thank you.
Any additional questions or comments for either of our speakers?
I have a quick question. My name is Juana Martin. I'm from Madison College. Thank you both. Both talks were very exciting, and now I have so many more ideas. My first question is for Sheela. I'm interested a little bit in what you mentioned about non-traditional learners who are taking this program. And we are struggling a bit at Madison College with our scheduling. When we tried evening classes, some of our more traditional students weren't accommodated with it, and then if we try daytime classes. So I'm a little bit curious to learn more, Sheila.
Um, how are you, Anna? Nice to meet you.
Nice
You're
to
my
see you.
fellow Midwest friend. Yeah, we struggled with this a lot too. So in our grant, we did put in embedded tutoring. So in every of our classes, including the labs, we have an embedded coach and a tutor. So the job of the coach would be to help navigate life situations. And the job of the tutor would be more academic to make sure that they can get a B and above. So it was not the same person doing both. And then we also had a common student advisor who could help these students to figure out transportation, childcare, those kinds of very nitty-gritty things that sometimes it's so difficult to think about because many of us may not go through that. So we had three, it was like a tripartite kind of a cohort model. It was quite expensive, I would say, but it worked. Now, can it be scaled? That's a different question.
Thank you. That helps. Well, and since I'm talking, I have a question for Nicole as well. Thank you so much, Sheila. I was very interested in seeing your three-level model with the 9 credit certificate and then level 2 and then finally associate's degree. So that offers quite a bit of flexibility to learners. So I guess just a little detail on what are there different levels of jobs that students get between the certificate and level 2? And then where are the general education credits placed? Are they at the end or in the middle? I guess I'm brainstorming things for my program. So
Yeah,
some detail,
absolutely.
please.
So our occupational certification contains no general education courses. It's all biotech. And that one is actually only designed for our high school partner, Sheldon ISD. And so that is our dual credit process. So our students who are dual credit, who are interested in a, potential career or process in biomanufacturing, they do the occupational certification while in high school. And then the goal, hopefully with them, is to have them then come at the end of the high school when they graduate, because they do it over their senior year, is to then come and complete the AAS with us in 1 year. So they've already got the first year under their belt in high school, and then the second year moving forward. Because one of the big things in this industry is you're going to have a very hard time finding a company that's willing to hire a 17-year-old or an 18-year-old. So we said, well, if we do the occupational certification, then bring them back for 1 more year, we'll give them that final step, that push. And then now they'll be able to hopefully select a track. They can do like traditional biomanufacturing or now like the advanced cell therapy. So they'll be able to kind of choose a track for that second year. The difference primarily between our level 2 and our AAS is our level 2, you typically allow students to actually get a job. So they've completed all the coursework that pertains to biotech. And the only true difference between that course, that and the other one, is it doesn't have the internship. So our AAS, we help our students and we place them into internships within biopharma companies. So they actually get 3 to 6 months of experience. The level 2 is all the same coursework. It just does not contain that like foot in the door internship. A lot of the companies, what we've seen, will hire the student at the level 2. And then they will wait for them to complete the AAS before they officially hire them. So they hire them as interns, and then they give them a full-time offer once they actually have the AAS. Because there's a few, like you said, gen eds that are also the last step. So typically like the English and the social science. We only have, 4 general education classes, math, English, social science, which is economics, and language arts, which we do ethics. are the ones we've chosen. And so those are like the 4 classes, and students can complete those online while they're already in the workplace. So how you kind of design your degree plan too is a little bit, we try to push our bios, our micros, our chems toward the first year, and then the initial core classes. So then that way, when students do get internships, what we've kind of seen is after they have an internship, they don't come back. So we want to make sure that the classes that they have available are either night classes or they are the ones they can take online, the English, the language arts, things like that. Because in that way they can complete that while they're in the job site, and they're not trying to, work their job schedule around an 8 a.m. class.
Yeah, thank you so much for sharing that. It's a very clever design in the 3 levels. Thank you.
Thank you.
Do we have any additional questions or comments? And if I can ask Nicole and Sheila, did either of you have any closing comments or questions for your audience?
I mean, if you're currently in the process of writing a grant, I would just say, keep being patient. And always focus exactly just how Sheila said, always focus on your area. Build a training program based on the jobs that your trainees, your students will be able to get. It's like exactly like she said, it would make sense to build a cell therapy training curriculum in the middle of a water plant town, right? So, really, really build your curriculum and meet with your industry partners, because that's going to give you the best foot in the door for your students to land jobs after they graduate.
Yeah, thank you, Nicole. I would say find your allies. Look for people who match your mission rather than the details of the mission. Because if you align with the mission, the things will work out eventually. If not 6 months, it'll eventually work out. So find a whole lot of allies who can guide you, help you. Be as nimble as you can and as brave as you can, both. If somebody asks you to change some things, you don't have to put your foot down. You can say, let me think about it, and come up with a rationale as why or what you want to do. Because that is what has helped us. Be like water, meander everywhere you can, and just carry the weight, So
Thank you again, Nicole and Sheila, especially for those closing comments. If you will notice in the chat box, I did put the link for the evaluation survey. I do share these with the presenters, so please be as honest and forthcoming as possible. It would help them as well. And again, thank you to Sheila and Nicole and Kevin for joining us this morning and for contributing to our discussion. Please complete the evaluation, as I said, and then also more information on both of these 2 project talks can be found on the Innovate Bio website. And at this time, I would like to wish everyone a happy Friday and a peaceful weekend. Goodbye.
You as well. Thank you for everyone who attended.